was fortunate enough to be a medical student here at Lake Cumberland for my medical rotations, and it really allowed me to see how the residents interact and how the program works. I think that the program here provides what Dr. Weigel would refer to as good pressure, meaning everybody has to be part of the learning process, even if you're shy, even if you're a timid learner. And I think that's what I was. I think I was a timid learner. And so having that good pressure made sure that I was going to develop into the best physician that I could be.
I chose Lake Cumberland for my residency for many reasons. First, I really like the area. I really like being near a lake, and I'm from Kentucky myself, and I always wanted to practice in a rural hospital.
One of the reasons the program appealed to me was its unique curriculum. I appreciate the multifaceted approach to learning, as I feel it offers a very well-rounded experience. Additionally, I feel the program as well as the hospital has a strong connection to the local community and in making sure it provides the patients the utmost care that they need.
I came to Lake Cumberland Regional Hospital because I have a lot of family in Lexington and the surrounding areas. Immediately interviewing here, I fell in love with the amount of attention that Dr. Weigel, Dr. Blackburn kind of put on their residents and how they teach you every day.
I decided to come to Lake Cumberland for several reasons. Obviously, I was interested in the area because it's near home for me. It was familiar, and I was drawn to, first of all, training in a community setting, which is relatively uncommon in internal medicine. But I liked that there was a program here and wanted to check it out. And when I came here, I was really impressed with the educational opportunities that were here, the exposure that residents had to patient care and to patient pathologies.
I really like the idea of the broad spectrum exposure that you would have in a rural environment where you get to really be active in all aspects of a patient's care. From a family medicine perspective, this is important where you have continuity of care between the nursing home as well as OB clinic and really taking care of the full lifespan for your patients.
You know, as a general hospitalist, depending on where you hope to practice, for here in rural Kentucky, oftentimes hospitalists are responsible for managing a lot of the critical care of patients in an open ICU setting. And that's one of the things I think our program does really well. And being a resident during times of COVID has kind of forced us to be very strong in procedures, very strong in critical care medicine. And I think it's made me more competent and more capable of doing those things as I move out into my practice.
The way that we approach wellness, self-care, paid time off here is first that we're provided 20 paid days every year for personal use. We have dedicated staff for continued wellness trainings, for solo or one-on-one sessions when problems might arise or when help is needed. Our noon lecture series is ongoing throughout the year. It's structured usually 4 days a week, Tuesday through Friday. Sometimes Mondays are included.
So our workspace at LCMA, which is our clinic, just recently was updated, and we have really good access to everything that we need there. That definitely makes our job easier to have the space. Everyone has an individual computer. They've worked really hard to make the space comfortable for us and make sure that we have what we need.
So for the family medicine residency, starting in the spring of your second year and all of your third year, it's new that we can do moonlighting in the walk-in clinic. We have a competitive hourly rate, and you get to work with one of the attendings you'll work with on a daily basis down in the urgent care center, which is one of the only urgent care centers in the surrounding counties that is ran by physicians. And also, once you're a third year, if you want to, you can work at one of the local rural hospitals in the ER also for moonlighting.
So here at Lake Cumberland Regional Hospital, particularly the Family Medicine Residency Program, they offer a lot of sports opportunities for the residents. So as a resident, we get to partake in sport physicals at several local high schools here in Somerset, Pulaski County High School, Southwestern High School, to name a few, as well as Lindsey Wilson College. So the sports physicals are pretty straightforward, but we also collaborate with, the team coordinators there too, to kind of work together. And then we also have an opportunity to do sideline coverage for several of the high school games, and those are really fun. That gives us kind of an opportunity to not only just watch the game and have fun, but if there are any sport-related injuries, gives us a chance to identify and be accustomed to the common symptoms of the sport-related injuries and how to address those appropriately.
We have 2 rotations on the obstetrics unit. So we follow through the labor and delivery unit, working closely with really brilliant nurses as well as the OB attendings. And that allows us through that time to get really a high volume of deliveries. I've had probably over 60 vaginal deliveries and probably 40 C-sections in that 2-month period, which is really high volume, as well as really seeing women as they come through for triage and needs like that. So we're getting to really become really skilled at that aspect of the patient's care.
Our support network around Lake Cumberland Regional Hospital, it's unlike any other place. Dr. Weigel and Dr. Blackburn, they always have this open door policy, but they're also in the hospital as well to kind of meet up with you and to talk with you. They also have Mark Ham, who is trained into helping deal with difficult situations. We're required to meet with him, 4 to 6 times per year.
Well, my name is Mark Ham, and I am the wellness coordinator here. I do professional counseling, but I basically oversee the wellness component for the residency program. So we try to meet with everybody at least once a quarter. And with an emphasis on that being on the interns on the front end, because that really is a shock to the system, almost everybody you talk to. So that is a very difficult transition to go from medical student to resident. So we try to get to them early. And really what we do is walk around kind of the 7 or 8 domains of wellness and do an assessment about how are you taking care of yourself spiritually? How are you taking care of yourself physically? Are you eating right? Are you sleeping right? Are you getting moderate amounts of exercise?
I tell any potential resident that's thinking about coming to Lake Cumberland Regional Hospital that it's a very supportive environment. You're immediately trained on procedures. You are supported throughout the entire day and throughout the entire year with attendings that have trained here as well, and they're also your teaching attendings in the hospital as well. So you get to kind of see how you progress as a first year to when you're attending after the 3 years here.
It's a time where you have to learn how to mature in your training. You have to be there for your patients, but you also have to be there for yourself and then for your learning outside of just being in the hospital as well. The program here has definitely provided that support for me. That's with my colleagues, with my mentors in the hospital, with the program leadership. And I think that the best times that I've spent here were times spent with my class and with my colleagues, both inside and outside of the hospital.